Dr. Kamek.
Hi.
Hello, how are you?
How are you today?
I'm well. You look gorgeous today.
I tried. My daughter just called me out. She's like, "Why are you getting all fancy?"
Oh, no, she didn't. Tell her you're having a sister circle.
Yes.
Yes. So tell us a little bit about yourself and the work that you do with Black mental wellness.
Yeah, so I am a licensed clinical psychologist, and I am a co-founder and the current president and CEO of Black Mental Wellness. And so we really started out of a need of wanting a space for information, for resources related to Black mental health. And at the time, there wasn't anything out there, so we created it. So you can go to our website, www.blackmentalwellness.com. You'll be able to find a wealth of information related to Black mental health, like mental health and how it looks in Black people, because sometimes it looks very differently. We have coping strategies, we have resources. How can you go and find a therapist? And we're always expanding the information that's there.
So, Dr. Kamek, we both look amazing. I'm going to take that. I'm going to own that.
Yeah.
But that doesn't change the fact that I'm a single Black mom. I'm feeling all the feels. I have an 8-year-old and a 5-year-old. I'm running a business. I also work full time. What are you seeing right now? What are you hearing from Black mothers?
Black mothers are tired. It's very it's sort of disheartening at the same time, because even in a therapy space, Black mothers are exhausted. You know, they're talking about, I'm taking care of my family, I'm going to work, I'm homeschooling, I'm trying to help my parents with this, my siblings need this. And then in the midst of that, I always ask the question, well, what about you? Where do you fit in the midst of all of this? And there's sometimes this responsibility that we have so much to take care of other people that we forget to take care of ourselves, and may even feel guilty when that happens. And so when you don't do that, what I like to explain to people is that the stress is still there. So I start to hear women talking about, well, I'm drinking more. And, you know, like, oh, I'm not exercising the way that I would before, or I'm not sleeping the way that I would before. And that's going to still impact how you parent, how you feel, how you are as a partner. So it's just like a ripple effect. And a lot of times it's like, let's take a step and figure out, in the midst of all of this, how do you take care of yourself? How do you find that balance so that you can maintain your business, take care of your kids, and do everything else?
So we've also, it feels like all of a sudden, gotten this welcome surge, this wave of appreciation from our allies, from other white moms. But at times that can be overwhelming. What are your thoughts on how we handle that newfound ally without compromising our mental health?
Mm-hmm. I'm a big proponent, like, if it stresses you out, or if it's more work, educating the allies, or like, you know, getting into those conversations, because the thing that we have to remember is we're also healing through what's happening right now. And so maybe I just don't have, I like to use their word, this is what they say in my job all the time, I don't have the bandwidth
to
take care of you and heal myself. And so a lot of times it's like, you know, I love that on social media, there's this big push to say, educate yourselves. And don't feel that responsibility, because we also, Black moms, here we go again, we always feel this responsibility. Well, it's my job because they're asking. No, it's not. Let them figure that out. Take care of yourself. You already have enough on your plate. Take care of your children. And then you can decide, well, what do I want to share with allies? When is it available? You know, when is it helpful for me to do that? When does it work for me? And then you can redirect them if that needs to be the case too. Don't take it on.
I love it. I'm going to hand it over to Blessing to continue interviewing you.
Okay.
Thank you so much. I'm not sure what happened to my laptop. It was fully charged, but it decided to shut off on me. But thank you so much, Dr. Kamek, for joining us. Really, really appreciate you. I had a few questions prepared for you, and one of them is emotional trauma that we are seeing. And you started touching on it around, you know, just the questions and the fact that it's not, we're not even being acknowledged, right? I know I work full time, and I literally showed up at work right after, you know, the George Floyd incident, And I had spent the night I couldn't sleep. I was tossing back and forth, just wondering, what if that was my husband, right? What if that was my son? And I just want you to touch on just the emotional trauma that we are facing as Black mothers, because it is affecting our sleep, it is affecting our mental health, it is directly affecting our income. Because when you cannot focus, when you don't have the capacity and the bandwidth, right, to focus, to get things done, it starts to, seep into other things. So if you can just share something around how can we deal with this emotional trauma?
Yeah, I think the first thing is exactly what you say. There's so much emotional trauma. And even in this movement of say her name, protect Black women, and all of these things. And I'm always like, well, part of the heaviness that Black women are dealing with is that it's our husbands, our fathers, our brothers, our uncles, our cousins. And every time it happens, our sons, right? You're thinking about this could be my family member. Maybe your family member has had those types of experiences. So there's the heaviness with that. You're trying to protect your family in the process of that. You're worried about your own emotional response, the response of your children and your family. And then you still have to work and maintain everything else. And so the first thing that I would suggest is just checking in with yourself to even be aware. What are you feeling? Is it impacting your sleep? Have your behaviors changed? Are you, changes in how you're talking to your friends, or if you're isolating? Because a lot of times we're so automatic that we don't even realize there's been a change that's happened. Once you're aware of it, now it's time to implement some strategies. How do you carve out that space? And I get it. It's busy, right? Where do you find the space? But maybe there are little places where you can say, all right, this is going to be my time to take care of me. What are the things that I need for that? So it could be journaling. It can be meditation. It can be tapping into your spirituality and what that means for you. It can be exercise. I know we're also facing a pandemic, and that gave us all like instant increased stress and responsibilities. But how do you still take care of your health? How do you watch what you're eating? How do you watch what you're intaking? And not just like eating, but mentally, what are you watching? What are you listening to? Those are all some places where you can make some instant changes. So I'll use myself. And sometimes I think I sacrifice my sleep for this, but I can't start my day in the busyness of someone else. So if that means I have to wake up earlier, and I hate it, but I do it. If I have to wake up earlier to have that quiet time to reflect on what I want to do, to watch my reality TV, whatever those things are, that's when I can exercise. Make that time for yourself. I also make it a point to make that time at night. But I think most importantly, as Black women, give yourself permission to put you first. And imagine the lesson you're going to give your children when they see you taking care of yourself. So part of, how these things are passed down is like, my mom didn't take a break. My mom wasn't stressed. My mom, because they shielded us from so much. But you're giving your kids the permission and the authority to say, oh, I'm not okay, and I need to be able to do that. And so modeling that for them is also good.
I really love that, because I saw my mom working so hard, right?
Yeah.
And just trying to provide and get food on the table and clean up, and so it just became natural for me to do the same thing. Mm-hmm. I see a lot of Black mothers, even within our community, that are holding on to a couple of jobs and trying to hustle and doing all the things so that they can provide for their kids. And I was actually sharing right before you jumped on the wealth gap, as well as the maternal gap that is happening right now. I mean, it's been happening, but it's worsened due to COVID-19. So can you touch on, especially for moms right now that are maybe expecting, or they are in a place where there's a lot of stress, a lot of anxiety because of COVID-19 and the disproportionate impact to the Black community? Is there anything that you're hearing or seeing from your community on how people are dealing with this?
Yeah, it's like very disheartening, and COVID-19 and some of the limitations that they've placed on who can be in the room in certain hospitals probably amplifies that anxiety. I've heard of a lot of people sort of like seeking out doulas and midwives so that you have that advocate, that voice in the room. And I hate that we have to do that, but it's like, the other side of that is do whatever it takes to take care of yourself and to make sure that these doctors hear you. I also think it's important to have these conversations with your provider before you even get to the hospital. So when you're having those visits and when you're going in for those checkups, have the discussion. See where your doctor, how they're thinking about things. Do they hear you when you go on your regular doctor visits and you're saying, I'm not sure, I'm feeling a pain, or is this okay, or is this normal? If your doctor seems responsive, or are they dismissive even on those checkups? Because I'm looking at that stuff differently now. If I feel dismissed in the room, it's time for me to find someone else. And ask your friends, like, who did you go to? What did you think about your doctor? So that a lot of times we just go where we've been going all of this time. And it's like, no, you have the power at this point to decide what's best for you. So I think those are some of the things that you can do. I know that people where their partner can be in the room have talked about, here are some like keywords or things that I need you to hear from me, so that if these doctors aren't listening, you need to talk to them on my behalf.
Absolutely. And that is very important because, Black mothers are 3 to 4 times more likely to die due to pregnancy-related issues than white moms. Mm-hmm. And a lot of it has to do with advocacy. And for everyone listening, there is nothing better you can do for yourself in a medical setting than to advocate for yourself. Mm-hmm. I've had 3 C-sections, and I've had 3 different doctors for those 3 different C-sections. And I conduct interviews. I conduct interviews. I mean, first of all, when I go in, they assume that I'm on, she's on Medicaid. We're not going to listen to her. Again, racial discrimination that Black women basically suffer from just the general population. Mm-hmm. And so, I've had to say, no. These are some of the conditions. I need to know that, when I'm on the operating table, I'm going to get the 100% attention from you and all the other nursing staff on duty, or the doctors. So again, interviewing, advocating, very important. One more question for you on the topic of mental health, because I know that a lot of us right now, because of what's going on, we've decided to I'm protecting my energy. Mm-hmm. I'm protecting my energy. I am not, I'm not spending time engaging and having multiple discussions. But I want to hear from you in terms of our allies, right? Mm-hmm. So a lot of them are starting to talk more, and more Black people are retreating, right? So how do we close that gap in a way that doesn't say, we don't want to listen to you, or, get out of our face? How do we have that conversation, right, with them? And also, even for the mental health of our allies, because a lot of them, as we know, were not part of this whole situation. Yes, they've benefited from the privilege that comes with, the color of their skin, but, they weren't exactly directly perpetuating, racial discrimination. A lot of them are unaware. I think that's really it. Is that they just don't know that what they're doing is helping or sponsoring slavery in some sense in today's world. So what advice do you have for those allies that are seeking to basically close that gap, and also for the Black mom that is retreating and saying, you know what, I don't have the energy to educate you?
Yeah. It's a tough balance, because there's this, the positive, I guess, in this situation, or maybe what feels different this time around, is that the allies are asking questions that feel meaningful in some way. And they're also like seeking the knowledge to say, how do we make a change? And realistically, in order for us to make a change that's going to make our lives better, our children's lives better, future generations, is going to have to be the unity of everyone seeing this problem and working together. So we get that, but it's just been a lot at one time, right? So I think that for Black moms, being able to, you can put the boundaries up and then maybe figure out what are some ways that you can start to open up and talk to some of your friends. You don't have to close them off completely, or you can say, oh, can we talk about this at a different time? Or you can, come back to them at a later time and say, here you go. You can also think about like some resources so you don't have to go into all the logistics of it and giving them all the information. Like, here may be a good place for you to start. Maybe check out these websites or check out these books, and then maybe we can have a conversation after. So you can maybe figure out when you want to have the conversation. But I do think it's important not to close that door completely and to come back, because the truth of it is we have to be a part of the conversation to get the change, because it's been us who's been going through it. And we don't want someone else to tell us what they think should happen. That information has to come from us. And then for the allies, I've been sort of on the fence with this too, because realistically, although, like you said, they've benefited with the privilege and with some of the systems set up in their favor, for some people, this has been, unfortunately, the eye opener. This has been the first time that they've been exposed and getting this knowledge in a way which can feel, I mean, we know the heaviness, but now they're also dealing with the heaviness of, not only has this been happening, I had like this privilege that, allowed me not to see it. And I had this ignorance about the world that I didn't know, or I didn't take the time to understand. And so, just really understanding that they also are having emotional responses. And so for the allies, as that happened, I would just recommend also seeking additional support, seek therapy, talk to your confidants, talk to people who have been allies all along, and see what have they done to help them cope during that time.
Thank you so much for that. One question came in, and it's something that I'm struggling with as well. Support at work, especially for Black women and Black men. A lot of us, went back to work, and it just seemed like business as usual. There was no communication, nothing around, you should feel safe here.
Yeah.
And afterwards, when we started seeing some companies, like Nike and Google and the rest of them come up and say, hey, we stand against racial discrimination, some companies started coming up.
Yeah.
And, I personally was not excited about the lack of communication. So how do you even talk to your job about improving the support for Black mothers? Because, or even Black women, but let's start with Black mothers, because, a lot of Black mothers, we've just gone through the statistics, 3 times likely to die from childbirth related issues, 3 or 4 times. And then you're also looking at the different health complications. Just because you're a Black mom, right? High blood pressure, kidney failures. These things affect our health, and it sometimes, most of the time, affects our job. Because like I said, 85% of Black moms are co-breadwinners or breadwinners. And so this is a huge issue. How do we advocate? How do we ask for support at work?
Yeah, I'll tell you, personally, I went to my job and I asked for help. And maybe I demanded a little bit. I'm in this different space right now. And I recognize like everyone may or may not have a job where it's even open to have those conversations, or you may not be in a position where you will be heard. And so I think that that's also maybe, something that's different for the situation that I'm in. But my job I came the Monday after all of the demonstrations and all of that. And my job was like, oh, it was such a great weekend and the weather was beautiful. And, this is what's happening. And I'm like, how disconnected can you be? Mm-hmm. And I told my job, and they're like, Nicole, how was your weekend? I'm like, actually, it wasn't well, because there are Black men being murdered by police. And then I'm sitting here trying to figure out, how do I maintain my own health and the health of my child during the middle of everything that's happening, coupled with we're already still adjusting to a pandemic.
Correct.
And so my boss at the time, he was disconnected, but we had a conversation about, like even when I'm on these conference calls, I'm still a mom. And so I have to mute the conference call and talk to my child, and I have to answer her questions, and I have to be there in a way. And what can the job do to support mothers during this time, to support families in general? But you're thinking now specifically, how do you support Black moms? Like we have, there were 2 Black moms on the call, and neither of us feel supported by our job. And so we talked about different things that can happen, like they started educating themselves, and then it started to be, so what are some resources we can have at the job if you need that additional support? What are some ways? I asked them about like time off, like moms need time to take care of their children. I didn't get an answer yet, but to be able to have that conversation about, there are going to be days that I'm going to need to take time because for my own mental health and my own family. We had open conversations about differences in pay for Black women. I, at the time, did not know that it was as steep as you just presented in the beginning. I didn't even know that.
Mm.
And so I was having a conversation half informed, but those are some of the things that we've started talking about. I think what stood out for me most during this process is watch how your job responds when these types of things happen. So when we're dealing with the pandemic, where we're dealing with this racial and civil unrest, when we're dealing with all of, having our kids at home and saying that we're stressed and saying that this is difficult, watch how your job responds. Do they treat you like just an employee and they tell you to get it together, or are they trying to put systems in place? And I think for me, it was like, okay, well, this will determine where my next steps are career-wise.
Absolutely, absolutely. I mean, just to kind of in the same vein, I went back to work that Monday. Like I said, I didn't get any sleep, and I had a call at 8 a.m. and we had a check-in, and it was about dog safety, and I was like, did I miss something?
Mm-hmm.
What? And so this is just to show the huge disconnect in corporate America and what's really going on in the homes and families of the employees that work for them.
Yeah.
And I'm glad, that we corrected that immediately in my group, because I spoke up. I said, you know what? I am not proud to be a member of this company. If this is how I'm going to be treated, I come in and we're talking about dog safety over people's lives.
Yeah.
We need to be realistic. We need to be empathetic, and we need to know that these are our brothers and sisters.
Mm-hmm.
And since then, thank God, they corrected themselves, and they've since been championing. They actually give us some additional holidays.
Good.
Overall. But this is just to show that we need to advocate for ourselves wherever we are. Advocate for our children. We don't have enough time to go into just the way our kids are being traumatized, even in school. Singled out for various reasons, just because they are out there being boys, right? And they're not the only boy in the class, but we're gonna pick on them because they're Black. So we need to advocate for our children. We need to advocate for ourselves. So I really appreciate you coming on, Dr. Nicole. Really appreciate you